welcome to Doctors on Call. I'm Mary Morehouse, psychotherapist at Insight Counseling Duluth, and I'm your host for our program tonight on stress and anxiety. Our panelists this evening include Dr. Steve Sutherland, psychiatrist from Essentia and Amberwing, Dan DeAllard, psychologist from the Duluth Psychological Clinic and Northwoods Children's Services, and Josephine Eads, psychotherapist here in Duluth. And now on to tonight's program on stress and anxiety. Thank you all for coming here. This is one of my favorite topics, something I specialize in, and I just think it's so prevalent in this world right now. It's such a topic of conversation, and so we got a lot of questions, so I'm really excited about really diving into those. So I'm going to start with you, Dr. Sutherland. Kind of a medication question. So how do I know when I need medication? So what are kind of that psychotherapy versus medication and together? So if you could speak on that.
Sure. When it comes to anxiety, the gold standard, the only thing that's curative in an approach to anxiety is, doesn't have to come in the form of psychotherapy, but anytime we are taught or teach ourselves to face fears and learn to, or teach how to calm our bodies down, oftentimes that process happens in psychotherapy. That has a potential curative effect. We actually lay down new neurons and kind of help create detours and healthy pathways, and so medication has a different role than that. Okay. The way I would put it best, I think, is to say that when the process of living with anxiety, both the sense of adrenaline and tight muscles and racing thoughts and other physical manifestations of anxiety, when that crosses over with loops of thinking that distract a person from other things that they'd rather be doing or need to be doing, and when those are present on, let's say, more days than not for a 2-week or longer period, and it's not responding really well to the intervention the person is trying to do, oftentimes that's the time to consider medication approaches, and what the medication role is different than that approach to the therapy, which is the goal with medication is to help the body regain its maybe reboot or reset process, so that those circuits get a little bit of a boost. If the medication is working, the body gets a little bit easier time getting back, rebooting or resetting back to equilibrium.
Okay, and with medication, is this, I'm sure there are all sorts of timelines that you can be on medications. I think sometimes there's a hesitancy to go on medication because I don't want to be on this for the rest of my life. So what are your thoughts on that? Obviously, it varies.
It varies, yeah. I mean, the main medication treatments that are effective for treating anxiety disorders are those that are daily medications, the same medicines usually that treat depression for that matter. And once a person goes on those, if they're helpful, usually it takes somewhere between 2 and 6 weeks to know is the medication being helpful. Once they're on that, then oftentimes you look at the first 9 to 12 months of a helpful medication before you consider tapering off, and that's the kind of time period we look at. There are also such things as needed medications for anxiety, but those really play a supporting role in, let's say, a person with generally stable anxiety who panics when they go on an airplane and want a dose of an as needed medicine or something on that order.
Okay, great. Thank you so much. Dan, is sleep good cure for anxiety?
Sleep is wonderful for lots of reasons.
Yes,
I'm not sure it's curative for anxiety, but it might be necessary. Good sleep might be necessary but not sufficient to help with anxiety. Anxiety requires more of our resources to cope with than a baseline, relatively anxiety-free state. Sleep rejuvenates our resources. So to sleep well will almost always help with coping with anxiety, not curative. Anxiety, of course, can interfere with sleep, and that's another matter. But yeah, if you're struggling with anxiety, prioritizing good sleep makes a lot of sense.
Yeah, and so for falling asleep, staying asleep, or waking up too early. So those are kind of some of the questions I always ask. So do you have any tips for falling asleep, staying asleep, or waking up too early?
Certainly for falling asleep, good sleep hygiene makes a lot of sense. Not a lot of screen time or bright lights before you go to sleep, not a lot of food or other intakes, certainly no caffeine intake. I think 6 to 9 hours is roughly, Steve, the recommendation. So good sleep hygiene, and try not to be thinking about stressful things while you're going to sleep. Easier said than done, but sometimes journaling beforehand or having a conversation around dinner time about stressful topics but not later can help. Staying asleep, I don't know, I think maybe some of the same things that would work for falling asleep would help Also, not staying in bed if you're having a hard time staying asleep. So get out of bed, do a reset, come back to sleep. If you're waking up a lot before you want to in the morning, that could be a sign of depression. Sometimes that early morning awakening could not be about anxiety. So make sure you got an accurate assessment there.
Okay, okay, great. Josephine, so a question about toxic work environment and no jobs prospects. So kind of being stuck in a not great work environment and the stress and anxiety with really nothing lined up. If you could speak to that, Josephine.
Sure, that's a really good question. I think there's a lot of people who are probably feeling stuck in a position where they're at, whether that's because they don't have the education that they need or whatever reason that they're feeling stuck. One of the things that I would recommend if you're feeling stuck in a toxic work environment is to at least consider, spending some time thinking about your exit strategy. It doesn't necessarily mean that you're going to do it right away, but sometimes we can kind of trick or coax our body into being, what is the right word for what I'm trying to say? I think, therefore I am, right? Like if you're thinking about it, your body's going to respond as if it's doing it. So to sit down and to create a strategy, think, what is my next step? Dream, like doing all the things that we tend to forget about doing when we are under anxiety. We pull in, we think, I can't do this. It becomes a no-win situation in our brains. So to just kind of set aside all of those, negative things that tend to take away our reserves and make us feel even more stuck, but just stop and say, okay, I'm going to do a reset. I'm going to think to myself, what is one thing I can do today to make a change in my life? And it might not even be about your job situation. It might not even be about work. It might be about something else that's going to fill your cup. It might be doing some yoga, getting back to tap dancing, whatever it was that you used to love and enjoy. And then the more you fill that, the more you're going to feel like you have some energy and some of your old self back to start looking for something else.
When's the last time you felt like yourself?
Kind of, yeah.
Kind of go back to some of those things that it may have been in high school, but what were those elements of making you feel like yourself can kind of sometimes be a little bit of a clue to how we can kind of improve from moving forward.
Exactly.
Yeah. Okay, great. Thank you. Another question. So, and this is kind of a question we see a lot, or kind of this a bigger discussion: THC gummies and cannabis use, because it's legal now. I feel like we have to think about it differently. We have to talk about it differently than I was trained. So our THC gummies and cannabis use, I hear from my clients that they use it a lot to help them fall asleep and with anxiety. We talk about that, but what are your thoughts on that, Dr. Sutherland?
Interestingly, first off, the scientific dialogue hasn't really changed since legalization.
Okay.
The scientific dialogue is the same, and almost universally, people who use cannabis on a regular basis describe it as having a calming or mellowing, or however the terms might be, effect on their demeanor at the time. And notably, when it's been studied in good scientific methods, when they've tried to, for instance, say, take people with panic disorder or people with post-traumatic stress disorder, real-life anxiety disorders, and compare what are the treatment results when somebody tries a certain medication or psychotherapy or cannabis or some blend of different things. There's zero scientific evidence that cannabis treats anxiety disorders. It was a really interesting decision of the state medical cannabis committee to add post-traumatic stress to the list, because there's almost no scientific evidence that it helps. So what we're left with is, like a lot of things where science doesn't provide the answers, is people's individual reports. They'll just say, I feel this way when I take this thing. And that's where we're at. But there's no real scientific evidence to support that there's a role for us to say recommend the cannabinoids as a treatment for anxiety-related conditions.
And can it increase anxiety?
Yeah, it certainly can. There's all kinds of ways in which cannabis, when the metabolites build up in the body, can interfere with things ranging from our digestive systems to the way our stress hormones respond to stress. And so, then we can sometimes see that compounding effect of increasing anxiety.
Okay. So, Dan, how long should a person struggle with anxiety before seeking help? And I think that that's kind of a good kind of overall question of when, when is anxiety, how to distinguish between protective anxiety and problematic anxiety.
Yeah. So anxiety is part of living. So we're always going to have some form of anxiety or stress. When to seek help, it sort of depends on how you define help. Sometimes psychotherapy is the help, sometimes medicine is the help, but sometimes your own decision about who to talk to when, or how to structure your day, or what new challenges to take on. So I think you want to try to do a pretty thorough job of exhausting your own resources to figure out what's stressing me out, what's causing anxiety, what can I do about it, who can I talk to about it in my own life. If those efforts aren't successful, and if you find that your stress and anxiety is impairing the sort of life you want to have, it's your sleep, your relationships, your work, your academics, that's probably a good signal. I've tried what I can do and it's still impairing. I think those are good markers.
Okay, great. And is there any difference, between like the age, from little children, knowing when to seek help from a parent perspective? When do I seek help for my child? Big question. Versus kind of this young adult, and then also kind of this elderly population. Do you see any differences or any way you would kind of tweak some of those?
That's an excellent question. As with most parenting matters, parents sometimes have to be the judgment for kids, and that's true about anxiety. So again, if you've helped your child try some usual things that might help. If this person bothers you, see if you can get your seat moved in the classroom. That sport is stressing you out, maybe we can switch sports. You try to do those things. But again, if they don't work and they're impairing, then maybe it's time to seek help. For older folks, of course, they have their own independent judgment about it. But again, is it impairing? Is it getting in the way of the sort of life you want to live? And you've tried things, and of course what they can try is different than what real young people can try. So I think the principles are the same, but how you apply them across the lifespan obviously differs.
Okay.
If I could add in to that too.
Please go ahead.
We've seen an increase in this since COVID hit 3.5 years ago, or is it almost 4 years ago now? In that school avoidance is more prevalent now than ever. And anxiety and avoidance have always been in the human condition a natural pairing, right? What's famous is that anxiety or fear causes a fight versus flight response, but there's also avoidance is a natural human instinct in response to anxiety. And so there's more and more kids than ever that are saying, I can't go to school, I'm too anxious, the place makes me anxious, etc. And that's one of the ones where, as Dan was saying, the parent direction about saying, listen, I believe you're anxious, and there's no way that anxiety gets the final vote about whether you go to school or not. We're there for you, 100%, we're going to try to help you with that anxiety, but it does not get to tell you where you attend or where you don't attend and what you get to do. And oftentimes parents struggle to get into that role because they feel like they're there to support their kid, and it feels sometimes almost punitive. Parents describe trying to get a kid who doesn't want to go to school, for instance. So that's just another angle on that question too, of parents needing to be directive.
Yeah, absolutely, and that kind of goes to that whole, with COVID, with all the kids, that there was no uncomfortableness for the kids. They could watch online school with the screens off, laying in their bed, taking a nap, and so all of a sudden going back to school became very uncomfortable for a certain set. As a overall general rule, my introverts loved online school, and my extroverts were the ones in my office. And then when they went back to school, it flipped, more or less. That's obviously very general, but that kind of that dealing with this uncomfortableness and things there wasn't anything we could do, so there weren't a lot of things that people had to do. And so I think that has kind of gotten into, especially with school-age kids, it's tough.
Before we move on,
yes, please,
last piece,
please, absolutely.
Just because I am a mom of a new baby, and I think sometimes a segment that gets missed is that postpartum depression is something that people are talking about a lot more, but a lot of women don't realize that postpartum anxiety is also a thing. And when you have a young baby, right, you have a lot going on, and so it's normal to have a certain amount of anxiety. It's normal to have a certain amount of feeling of overwhelm and oh my gosh, I'm drowning, I can't do this. And I think a lot of times people will miss the fact that, this might actually be a clinical, like I might be more anxious than I need to be. And so just to kind of put that into people's minds too, of like, if you're feeling really where it just feels like it's too much, talking to your doctor about potentially getting a referral or, reaching out to your friends, psychotherapist, somebody, you don't have to struggle alone with that. And it is a thing.
Absolutely, you're right. I think the difference between postpartum depression and anxiety is not talked about enough. So thank you for that. So Josephine, continuing with you, some good coping mechanisms for dealing with stress. Obviously, it kind of depends, but just kind of overall, what are your, I know I'm asked this a lot,
right?
It's one of the big questions we get.
Always.
Is how do I deal with it?
Yeah. I know I have it. Now what?
Yeah.
Like how do I cope with this? What do I do? And you're right. It is dependent on what's happening in your world. It's dependent on if it's just a normal level of stress and anxiety. If we're talking, we're at a panic level, what you're going to use is going to be different. You're going to have a whole set of tools, and some of my favorites are, I like to talk to my clients about, we're gonna hit anxiety from a two-pronged approach. We're gonna look at reducing your baseline anxiety, because that's gonna help your overall ability to be resilient and to cope with it. So we're gonna do things like looking at your daily routines. How can we change your daily routines? Yoga is a huge favorite of mine. I'm a daily practitioner. Well, I used to be before I had the baby. I gotta get back to that.
You'll get there. You'll get there.
And that's, I think, also something to if you're beating yourself up about not doing the thing that, I used to be doing, well, you know what, you can always get back on the horse, because even therapists take breaks from being really good about their mental health. But so doing things like your daily yoga routine, mindfulness, running, like whatever it is that is, your, whatever is your flavor, and find that daily thing that you can do. Even 3 minutes of mindfulness, like a lot of people will say, I don't have time, I can't do it. It's too hard to carve out that time. I know I have 2 young children, so I don't have time. Like, where am I supposed to find that? Okay, so I have 30 seconds. I'm waiting at a stoplight. Instead of like running through my mental list of everything that I have to do when I get home, I can take those 30 seconds and just be present. I can breathe. I can use my 5 senses. I can listen to my daughter as she's talking to me and telling me about her day, instead of kind of tuning out or saying, like I can be in the moment. And that is, I think, really good. So all of those things are sort of like that general, reducing your baseline. And then there are things that you need, like in the moment, right? I'm having a panic attack. I'm experiencing an intense level of fight or flight. My body is, and then what do I do, right? Because you've got people around you that are telling you, just calm down, it's okay, you're fine. That never helps, by the way, don't do that.
Don't never say calm down.
Never say calm down to a person who's having a panic attack. It's not gonna work. But what you can do is just in that moment, like feel your feet on the ground. Again, like that is a favorite of mine in a panic attack. Like if if you don't have medication that's helping you, if you're just experiencing this for the first time, take a minute to just like use your vision and just zero in on something. Just describe to yourself, what am I seeing right now? What am I smelling? What can I feel? What can I hear? And just, again, ground yourself in the present moment, and that can help kind of take down that level of panic. Also, 4-square breathing is a favorite of mine. Taking a deep breath in and counting as you breathe in to 4, holding it for 4, breathing out for the count of 4, and then holding out for the count of 4. And all those things are just gonna help you to reset your nervous system. And then of course there are other things that you can do, like when things are more chronic, like if you have like more stress in your life than you're able to handle, that's a time where you might want to partner with a therapist and do some things like the Safe and Sound protocol, which kind of works to use music to help your system sort of reset and feel safe. Brain spotting, like any of these other things that therapists can be trained to do to sort of help you get in a place where you can attack it with all these other coping skills and use them better and more effectively.
And thank you. And the goal is not elimination.
Right.
It's management.
It's
and
management.
It's get it back to the level where it's working for you, not against you.
Yes.
And I think people come in and say, I want to get rid of my anxiety. It's like,
right.
well,
yeah.
let's talk about that.
Yeah. Exactly.
You wouldn't be here. You don't want to. You do not want to get rid of
you
your.
need a little bit. It keeps you
because
safe.
then you'd be dead.
Yes.
Yes. We want you to have a little bit of. I always say, I'm glad you had just the right amount of anxiety because you showed up here,
Got you
3
here
minutes
today.
before the session. Perfect, nailed it.
Yeah.
That's the kind of anxiety we want. I have to
Yes.
get there on time, so I'm not late, but I'm not,
Yeah, but not I'm showing up a half hour early to your
exact
office
half an hour
every single
or
time.
yeah.
We might be yeah, we can tweak that a little bit.
So risks and benefits for taking SSRIs for stress and anxiety.
Yeah, the same rules, risks and benefits, the same rules apply to depression and anxiety,
Okay.
which is convenient. The risks have to do with the common nuisance side effects of at least temporary stomach upset. Sometimes there are people, 8 out of 10 people can just basically choose what time of day is easiest for them to remember. But 1 out of 10 might get a cup of coffee effect. That means they'll have to be a morning person. 1 out of 10 will get the opposite effect and be sleepy and have to take it at night. And then there's the scary looking side effect of suicide warning, which fortunately there's evidence shows that only 2% chance, so 2 of 100 chance that a medicine would cause an increase in suicide thoughts, but it's on the label as clearly the scariest thing. So those are some of the, there's other quirky side effects like increase in yawning or a change in sweating habits and some things like that that can happen. Some people that they would consider a nuisance but not a reason to not take the med. The pros get back to what I was saying earlier about your body's capacity to return to equilibrium, to reset or reboot once stuck in a state of sadness and the thoughts that go with it, anxiety and the loops that go with it, irritation and the frustration that goes with it. Your body's ability to exit those loops can improve, as that's perhaps the biggest noticed benefit from taking a medication when it works.
And you mentioned earlier a lot of these medication, anxiety and depression, and there's a lot of times anxiety and depression co-occurring. So do you see that sometimes these medications, and also that's just kind of a bigger question of, of anxiety and depression co-occurring and how to kind of parse that out and treat that and deal with that?
Yeah, there are some studies, for instance, that show that 80% of the time it's impossible to tease apart which part of their stress that day, that person's stress is from anxiety versus which is from depression. It's integrated.
A little bit.
20% of the time it can be distinct.
Chicken and egg.
Yeah,
Yeah.
right.
Yeah. Just about a minute left here, but Dan, what are some long-term risks or harms of stress over a long period of time? So,
our bodies are designed to sort of have a burst of stress that we effectively problem solve for and then recover from. Chronic stress just overtaxes our body in so many ways, and it affects our sleep and our mood and our appetite and our ability to think clearly. So there's systemic effects from chronic anxiety, and so what we've been talking about here are ways to interrupt that so that you have episodic controllable stress that you problem solve effectively for. It remains a signal that you respond to effectively rather than something that's a signal that's always on and just keeps your body too aroused.
Mm-hmm. It's too elevated. Hence the the social media or being kind of having all this information coming at us. It's more than our bodies were really designed to.
From a stress perspective, social media is
Yeah.
diabolical. it really activates us far too much.
But yeah, and so
Yes.
that's one of the things I say: do more of what works and less of what doesn't. If the social media is stressing you out or the media is stressing you out, do less of it.
You got it.
I want to thank our panelists, Dr. Steve Sutherland, Dan Allard, and Josephine Eads. Please join Dr. Ray Christensen next week for a program on eye problems, cataracts, glaucoma, and macular degeneration. Thank you for watching. Good night.